You look fine. You feel mostly fine. And that is exactly why colon cancer is so dangerous. It doesn't announce itself. It whispers. Colorectal cancer is now the leading cause of cancer death in men under 50, and the second leading cause in women of the same age group, not in their 70s, under 50. The disease is rising fastest among adults ages 20 to 49 at a rate of 3% per year. And here's what makes that terrifying. Nearly 20% of young colorectal cancer patients had one or more symptoms for up to 2 years before diagnosis. 2 years of symptoms, dismissed. In the next 8 minutes, I'm going to walk you through 6 specific early warning signs that research has identified. Signs that can appear months to years before a formal diagnosis. We're going to talk about what they look like, why your body produces each one, and here's critically, when a symptom crosses from normal into call your doctor. Before we get to sign number 3, which is the one doctors say gets missed most often, even in routine checkups, let's start with the one most people already know about, but still get wrong. Sign number 1, blood where it shouldn't be. The most troubling early symptom is rectal bleeding, a possible sign of colon cancer that's not comfortably discussed beyond the bathroom. In the research, nearly half of individuals in the sample presented with hematochezia, the passage of fresh blood in or with stool, and abdominal pain. Here's why it happens. As a polyp or early tumor grows in the lining of the colon, it develops its own fragile blood vessels. Bleeding can occur from both the colon and rectum, sometimes microscopic, sometimes more apparent, leading to a gradual depletion of iron stores over time. The critical distinction most people miss: blood from colon cancer may not always be visible. Some bleeding is occult, hidden, and only found through stool tests. That means you could be bleeding from your colon right now and have no idea. This is why at-home stool DNA tests and FIT tests exist, and why any screening is better than no screening. Sign number 2, abdominal pain that won't leave. Picture someone in their early 40s, active, no major health issues, who starts noticing a recurring cramping on the lower left side. Not acute, not debilitating, just persistent. They attribute it to gas, to stress, to something they ate. They ignore it for months. A study published in the Journal of the National Cancer Institute found that abdominal pain, rectal bleeding, diarrhea, and iron deficiency anemia were each associated with an increased risk of early onset colorectal cancer, with symptoms appearing as early as 2 years before diagnosis. Having 1, 2, or at least 3 of these signs was associated with a 1.94-fold, 3.59-fold, and 6.52-fold increase in risk, respectively. Let that land for a second. One symptom nearly doubles risk. 3 together, more than a 6-fold increase. The pain itself happens because a growing mass irritates the colon wall, causes partial blockages, and triggers abnormal muscular contractions. It mimics IBS, it mimics gas, it mimics nothing serious, and that's precisely the problem. Quick pause here. If anything in the first 2 signs made you think, I've had that and brushed it off, drop a question mark in the comments. You're not alone, and that acknowledgement might matter to someone else watching. Sign number 3, a bowel routine that shifts and stays shifted. 1/4 of individuals in the early onset colorectal cancer study noted altered bowel habits, and those changes typically aren't dramatic. They're not a sudden violent switch. They're like a quiet creeping drift from your baseline. That drift matters because colon cancer starts as polyps and usually develops slowly for 10 to 15 years. During that slow growth window, a tumor can begin partially obstructing the colon. Not enough to block it, but enough to alter transit time. The result? Diarrhea when stool pushes past a partial blockage, constipation when the passage narrows too much to pass easily, or an alternating pattern of both. Any noticeable alteration in your bowel habits could be a potential red flag, including going to the bathroom more or less often than usual. The rule of thumb, Any change that lasts more than 2 to 3 weeks with no clear dietary cause warrants a conversation with your doctor. Sign number 4, the shape of your stool telling you something is narrowing the path. A sudden change to ribbon thin or pencil thin stool might happen if cancer is making the passage smaller. In colon cancer, a tumor can partially block the bowel, reducing the space stool has to pass through, leading to thinner stools. What's most concerning is when thin stools are a new change that's persistent. Important nuance here, and this matters. Thin or narrow stools alone aren't a reliable indicator of colon cancer, but unexplained changes in stool shape or consistency shouldn't be disregarded, especially if you're experiencing one or more other signs. Thin stools are a serious symptom because they may be caused by an obstruction in the colon, like a tumor. If you're seeing pencil thin stools for more than a week, see a doctor. We're at sign 5 now. This one won't be on your toilet, it'll be on your blood test. And it might already be there, waiting to be read correctly. And the one most frequently missed, unexplained iron deficiency anemia. This one is critical because it can show up on a routine blood panel and be dismissed as a dietary issue, especially in younger adults. Anemia, particularly iron deficiency anemia, is not merely a symptom of fatigue. It can be a critical indicator of an underlying gastrointestinal malignancy, such as colorectal cancer. Why? Because bleeding can occur from both the colon and rectum, sometimes microscopic, leading to a gradual depletion of iron stores over time. Your body is losing iron slowly, silently, through bleeding you can't see, and that loss eventually shows as low ferritin, low hemoglobin, or a low red blood cell count on a standard panel. Studies show that iron deficiency anemia is often the first clue leading to a colorectal cancer diagnosis. This is why many doctors consider unexplained anemia in adults a red flag requiring further investigation, including a possible colonoscopy. Symptoms, fatigue, dizziness, and shortness of breath, all of which can significantly impact everyday life, easily attributed to overwork, poor sleep, or not eating enough iron-rich food. If you've been told your iron is low with no clear explanation, push for a conversation about your GI tract. Don't just take the iron pill and move on. And sign number 6, the second to last for a reason, because this combination is the one that catches people most off guard. 2 symptoms that often travel together in early to mid-stage colon cancer: unexplained weight loss and the persistent feeling that you haven't fully emptied your bowel, called tenesmus. The weight loss mechanism isn't dramatic starvation. Colorectal cancer symptoms can be subtle, including changes in bowel habits, unexplained weight loss, and fatigue. The cancer draws energy and nutrients, triggers a mild chronic inflammatory response, and subtly suppresses appetite, all without you consciously noticing a dramatic change. The tenesmus, that feeling of needing to go again, even when you've just gone, occurs because feeling like you can't finish passing stool is a recognized warning sign, as the Mayo Clinic notes, stemming from a tumor near the rectum triggering stretch receptors prematurely. Neither symptom alone is conclusive. Both together, especially alongside anything from signs 1 through 5, is the signal to stop waiting. Delays in detection were common. The average time from symptom presentation to cancer diagnosis was about 6 months. And due to that delay, younger adults often present with more advanced disease by the time it is detected. Here's what makes all of this feel urgent rather than hopeless. The 5-year survival rate for colorectal cancer is approximately 91% for stages 1 and 2, but drops to 13% for stage 4. The gap between those two numbers is not medicine. It's timing. Only 1 in 3 cases are currently diagnosed at stage 1 or 2. Among adults 50 and under, 75% of colorectal cancers are diagnosed at an advanced stage. The recommended screening age for colorectal cancer is now 45 for average risk adults. If your parent, sibling, or child has had colorectal cancer, your personal risk is 2 to 3 times higher, and those with a family history may need to start screening even earlier. The screening itself doesn't have to be a colonoscopy. Experts recommend colorectal cancer screening using either a direct visual test, such as a colonoscopy or a stool-based test. At-home stool tests are real, they're available, and they're a legitimate first step. Quick but important note before I recap. Everything in this video is educational. It's grounded in peer-reviewed research and guidance from institutions like the American Cancer Society, the NCCN, and the NIH. It is not a substitute for personalized medical advice. If any of these signs apply to you, the right move is to contact a real healthcare provider. Now, the recap. 6 early signs. Sign 1, rectal bleeding, visible or occult. Sign 2, persistent, unexplained abdominal pain. Sign 3, a shift in bowel habits lasting more than 2 to 3 weeks. Sign 4, pencil thin or ribbon-like stools, new and persistent. Sign 5, unexplained iron deficiency anemia on blood work. Sign 6, unintentional weight loss combined with the sensation of incomplete emptying. Remember the person in that waiting room at the start of this video? Healthy looking, unremarkable, asymptomatic, they thought. The signs were there. They just needed someone to explain what to look for. Now you know. If this video made you think of someone you know, a friend, a sibling, a partner in that 30 to 50 age range, share it with them. This is a conversation most people aren't having until it's too late. And I want to hear from you. Did any of these 6 signs surprise you? Which one did you least expect to be on this list? Drop it in the comments. I read everyone. Subscribe if you want more content like this. Real health science, no sensationalism, no filler. I'll see you in the next one.